Sometimes a tiny parasite hiding in your food can make you really, really sick. Today, guys, we're talking about a condition called Cyclospora infection, Cyclosporiasis, what it is, how you get it, and what you can do about it. Guys, I'm Dr. Jen. It is good to see you. Cyclospora infection is an intestinal infection, so it affects the stomach, caused by a microscopic parasite called Cyclospora. Now, this is a tiny organism. It's so small, about 1/10 the width of a human hair. It's so small you can't even see it. You can't smell it. You can't even taste it in your food or water. So you're not going to know if it's there. When you swallow the parasite, though, it travels to your small intestine, that's your stomach, where it then sort of gets into the lining of the stomach and causes inflammation. Now, this then can lead to severe and sometimes really uncomfortable digestive symptoms. You get Cyclospora infections by eating or drinking something contaminated with the parasite. So usually that's like fresh fruit, vegetables, or herbs that have come in contact with contaminated water or soil. There are actually some foods that are more commonly infected with this parasite than others. Some foods that have been most commonly linked to outbreaks include things like raspberries, basil, cilantro, and pre-packaged salad mixes. So this is really important. Now, something you should know is that you can't catch Cyclospora directly from another person. And the parasite does need time, like days to weeks, to mature in the environment before it becomes infectious. So it's really about contaminated food and water, not person-to-person contact, okay? In the United States, most of these cases will happen during the spring and summer months. Again, it's often related to fresh produce, like some of the ones I just mentioned. Symptoms usually begin about 1 week after eating contaminated food. That can be tricky in and of itself. I'll explain why, but symptoms can be watery diarrhea. Sometimes it can be explosive. You can have stomach cramps, bloating, nausea, loss of appetite, fatigue, and body aches, even low-grade fever, which we don't always get with like stomach symptom things, weight loss as well. Remember, I said that symptoms often begin a week after eating contaminated food. That makes it sometimes really difficult to understand what food it was that caused the issue. A week ago was a long time ago, and you probably ate a lot of food between then and now when your symptoms came. So sometimes it can be tricky to figure out exactly what foods are the source of that parasite. Now, if it's not treated, symptoms can last anywhere from a few days to over a month. They may come and go in cycles. So you actually want to get treated if this happens. It tends to be more severe in young children, older people, people with like underlying medical conditions or weakened immune systems and things like that. But there is good news here. There is treatment. There is diagnosis. Now, let me tell you, when one of the things we often do in the doctor's office when we are worried about some diarrheal illness, etc., we will take a stool sample and we will check for certain bugs in your stool, okay? If your doctor, suspects Cyclospora infection or any other bugs that can live in the stool, they'll take a stool sample. What's interesting, and this is probably more for doctors, is that the standard stool tests don't always check for Cyclospora, so us docs have to actually usually request specific testing. So a word to the wise for those of us docs out there. But the good news is that Cyclospora is treatable, which is awesome. A standard treatment is an antibiotic called Bactrim. You probably heard about it. It's been around forever, taken for about 7 days. People will start feeling better within just a day or two, usually, of starting treatment. So it's good. There are alternative options if you can't take that medication. But the really important thing is to understand that if you have diarrhea, it's not going away, you're not feeling well, you need to see your doctor because chances are we need to do some investigating. Now, I know you're probably wondering, okay, how do I prevent this? How do I take care of myself? How do I prevent this from happening? And that is, ding, 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 the name of the game. We don't have a vaccine for a Cyclospora infection, but there are things you can do. You know how we always talk about washing all fruits and vegetables under running water, washing them thoroughly, etc.? You really, 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 really want to do that. Even bags of produce that say triple washed and stuff like that, wash them anyway and wash them well. Wash in the nooks and crannies. Make sure you got good water stream, that you're really, really being good about that. If you're traveling to tropical regions, you want to drink bottled water, boiled water, and avoid raw produce. You want to always wash your hands. That's super important, right? Always. So I hope this is helpful. Just remember that if there are any unusual symptoms that you really ever experience, this is your note to seeing your doctor because we want to make sure we take care of you. Cyclospora infection is treatable and preventable, okay? Guys, I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Please subscribe to my channel on YouTube. Please follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, WhatsApp, all the things. And make sure you sign up for my free health newsletter at drjencaudle.com.